All right, we will go ahead and call the Health and Human Services meeting to order. Madam Clerk.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Right here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item, please.
B, approval of the February 9th, 2021 meeting minutes.
So moved. Support, Marecki.
Been moved and supported. All those in favor?
Aye.
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 Any opposed? Any abstentions? Motion passed. Next item, please.
Item 1, under unfinished business, we have a report from the administration on COVID-19 efforts / update on weekly public communication to the public and commission.
Thank you. Do we have anyone from the administration to speak on that report? The communication that's going out to the public?
Hi, this is Carol Osterberry. Oh, sorry, let me pull myself around here. And this is, you're talking about what we discussed at that 9 a.m. call, the senior vaccination program. Is that correct? Or
well, I guess it would be related to the 9 o'clock call, but in our previous meeting, we talked about how we would better communicate to the public what we're doing in Wayne County in relation to the vaccine. Right. And so basically your call this morning, you talked about that, yeah. But we don't know, we didn't have that conversation here in this meeting.
Right. Okay. I just, because I can also give the other report, you know, like just the weekly numbers and stuff too. So
I'm here, Carol.
here he is. Okay. Sorry.
Sorry, because there are two items. Good afternoon, everybody. Mohana Damami, Chief Health Strategist. My apologies, Madam Chair. There were two items. It seems that this one is a follow-up from last meeting, which unfortunately I wasn't able to attend. However, we understand that there is a lot of information that keeps changing, as well as information that needs to be shared. And I believe some of the issues that were brought up last meeting, as I was told, is how do we ensure that some of the information is made more available to the public, and how can we make sure that people that are seeking information would have it. There has been a great deal of extra information that we are updating as we move along on our website, specifically as we are now moving towards the senior vaccine dates and the campaign. We have that updated. We are using as well several of the media outlets, which in hindsight, some of the information probably backfired in making this more available for a lot of people, and it created a little bit of burden on our communities. So we are learning as we go, as they say, and what is a fair balance between what we need to have available and what is on a need-to-know basis, if we may call it that. I think with the
excuse me,
yes.
Dr. Hamami, can you give your name for the record, please? I don't think we did that part.
Okay, I thought I did. Mohana Hamami, Chief Health Strategist.
Okay, thank you.
Sure. I think on Thursday, when I had the opportunity to share most of the updated data with the full board, we forwarded that presentation to the clerk, and that is made available. We're looking to see, I know several commissioners called and asked whether that can be put in some way or format on the website. Currently, the website, I don't know how many of you had a chance to visit that, contains a dashboard of vaccines that were received and vaccines that were administered, as well as doses that are scheduled. So this is something that we keep updating on a weekly basis. It also contains the latest information as it relates to where seniors can get their vaccines from. We have a frequently asked questions based on the call that we had this morning with the communities. That document as well is going to be put on the website. So that's the update in what we're doing in ensuring that information is flowing to those that need it, and ensuring that we have communication happening. If you would like me to go into the second item and giving you a quick update on our efforts in Wayne County, and I wouldn't go into the full what we talked about at the full board, but there has been some minor updates. If you don't mind, I can share with you.
Yes, thank you.
Absolutely. And it might be helpful if I just show you, it's only 9 slides, so nothing major, but it would help in following with me. I hope that you can see my screen. This is for the reporting period of February 14 to the 20th. These are the total new cases of last week, as well as the number of deaths. But this is the graph that I wanted to show you. I know we talked about this. We talk about this with communities. These are the 14-day look back, and we take a 2-week look back of cases and we draw a trend. And what is so nice about this graph is here, this steep drop that is so beautiful, especially for data geeks like me. When they see something like that, they get too excited, and seeing that means we are literally at where we should be, and hopefully this will continue, although I think we're going to see a little bit of bump based on the cases that we saw yesterday. These are the top 10 communities in Wayne County. We compare them from week to week. Again, no major changes in the top 3. Dearborn Heights, and Canton are still in top 3, but there has been some changes in the total percentages of cases in Wayne County. Dearborn is dropping. Dearborn Heights picked up 2 points, and Canton 1 point. Again, these are all depending on the new cases that we're seeing in our communities. Our 7-day positivity rate from 3 periods ago continues to drop. We are, as of yesterday at 3 p.m., at 4.4% in Wayne County, and that is compared to 3.4 in the state of Michigan. But again, if you look at the trend, then it is going down. Nothing has changed since we reported on 9 of the B117 variant cases in Wayne County. We still are at 9, and we hope that we don't get any new cases. Let's talk about vaccines, which I'm sure everybody wants to know. So as of yesterday, we received our new shipment of vaccine, and by far, this is the largest we have received so far. So we received about 15,000 new doses. That is split between 5,850 Pfizer and 9,800 Moderna. But we also received our allotted for second doses of 5,850 of Pfizer and 2,400 Moderna. So in totality, we received 23,900 doses, which compared to what we were getting in the past, this is the largest shipment we had so far. Hopefully this will continue, and that these numbers, the 98 here and the 5,850 here, is what is enabling us to go out and now take a big chunk of the senior population that is out there. We have so far administered 40,000 doses, and that doesn't count some of the doses that we gave for other entities to help us with administration, which are around close to 2,000 doses as well. This is the schedule that our priority phases. We have completed everybody for dose 1 and dose 2, and by everybody, those that wanted to have the vaccine, those that are in critical healthcare, the long-term care. We are still tackling the necessary healthcare, the providers, but their numbers are getting smaller. We have completed all the public safety, law enforcement, the educators, and correctional staff, and in 21 days or less, we will start doing dose 2, and now we are in addressing the 65 and older. That includes 65 to 74 in Group 1C and 75 and older in Group 1B, and these are in progress. Of course, these were also and still are being handled by health systems, as well as retail pharmacies, Myers, Rite Aid, and others, including several geriatric clinics and FQHCs. So that's where we are. This is the schedule that we shared with the full board on where we are going to be. We started today, both in the city of Romulus and in Hamtramck and Highland Park at these two locations. So far, as of noonish, we received notes that everything is going great and everything is going according to schedule. We are seeing more, actually, than that was scheduled. Specifically in Hamtramck and Highland Park, we have to send back to bring more vaccine because we were expecting 300 today, and I think we surpassed 500. So we continue with the schedule. Some are I don't think this is going to change much. We are working on the schedule for next week, and as many of you who were on the call this morning with the communities, there has been a lot of lessons that we learned from going through this, and I'm sure we'll continue to learn and to see whether we can tweak the operations a little bit and ensure that what we are doing is serving our citizens and specifically the communities. I'm going to stop here and see if there are any questions.
Yes, so one of the questions, reoccurring questions, and I assume that you all are looking into that, is a centralized call center, which I think is a great idea. That was one of the things that came out on the earlier call this morning. And so I assume that you're moving forward with that. It's just for clarification.
Well, we started, in all honesty, we started contemplating or exploring this almost 4 weeks ago. Of course, we want to ensure that we have something that works for everybody. Also, we need to find the resources, specifically the funds available for that, and we also want to follow the process in getting something like that. But this is something that we're working on aggressively to, one, find out who can help with this, and also, if we decide to go in that direction, what are the challenges that we need to channels, not the challenges, what are the channels that we need to follow? But yes, it is something that we certainly are looking for. We had an idea several weeks ago that we brought up to the health system, especially when they were having challenges in online registration. And we pitched an idea, maybe all the health systems can come together and we would establish a one call center. That idea didn't go far too much, but we're still hopeful that maybe this is something we can explore.
Okay. And do we know
Chair, I'm sorry, to that point,
okay.
Dr. Hamami, I just also want to echo those sentiments of getting a centralized call center and a centralized online registration form for all of the residents, and particularly now that we're focusing on seniors for Wayne County, and that can be disseminated to each municipality. Just from my experience setting up the clinic in Plymouth Canton, that was the biggest challenge for us, was finding the resources to set up that call center and get those appointments scheduled. Our call center was completely overwhelmed. We had to find the resources to build an online registration form. That all costs money, and it's a resource on the local municipality. So if Wayne County could take the lead on that, I really would encourage that. Thank you, Madam Chair.
No problem. And is there a timeline on the call center? How far have you gotten into the crux of actually putting that together? Is there?
I can share with the committee that we are currently finalizing the specs of what we need in that call center, and that is should be ready by the end of the week. whether to go on a RFP route or to seek solicitations. This is where we're trying to look into.
Okay. And the second thing or I shouldn't say the second thing, but one of the things that we talked about is maybe a larger location for a centralized,
Right.
maybe, 3, 4, 5 locations that will take everyone that calls the call center and makes an appointment, and then you just go to that location or that location,
Right.
rather than trying to do all of the smaller, cities and smaller sites.
Absolutely, absolutely. And that is something that we immediately wanted to do because, as you know, we have both locations that are geographically accessible in Schoolcraft College as well as Wayne County Community College. If we put all our resources in one place, then we are able to do at least 2,500, if not 3,000 a day. I think that was the wish of the communities, because before we wanted to do that, we went to the communities and everybody believe that the seniors will be better served in their community. Of course, now we discover all the logistics involved and stretching the resources we have. I think going forward, we are going to approach a hybrid approach. So for communities that are willing to come together and we say we are going to assign one day at, let's say, Wayne County Community College for 1 or 2 of the downriver communities, that is something that we will consider. If we can say half a day at Schoolcraft College for those that were not able to go to Canton or something. So these are things that are, again, possibilities. We are continuing on the same tracks. My personal preference, to be honest with you, is to move towards a big, large center, but we know that this doesn't work for everyone. So we're still very sensitive to what are the needs in the communities and trying to accommodate that.
Or what I was really alluding to is that you have more community colleges or centralized locations that you then open up. That maybe they're not mega locations, but they could accommodate as you're doing now. So and by the way, I think you're doing a great job with what resources you have. It has to be difficult.
Thank you.
Well,
since we got the first shipment of vaccine, we had at least 17 locations, of which 5 are ready to be activated whenever but we didn't get enough vaccine to spread it.
Okay.
So that was, but we are certainly looking. We always have a plan for an extra. We call them pods because they're the point of dispensing where you can have more people coming to one location, and these are very geographically distributed. If we continue to see an increase in our vaccine supply, that might be what we are going to go for.
Great. Any questions from the committee? I see Commissioner Colleen's hand.
Anderson.
Also. Okay. And okay, did Colleen, I'm not sure who was first, but let's just go with Commissioner Colleen and then Anderson and then Marecki.
Thank you, Madam Chair. And thank you for being here today, Dr. Hamami. A couple of comments and a couple of questions. I was on the call this morning, and I must say when Mr. Turfy sent out the email for that call and provided us with the plan for how we're going to reach these 43 communities, I was just thrilled. We have a plan that we're working off of now. Not everybody can be first, even though they want to be. But I like the plan. Let's work the plan. There's going to be some things where, it's not 100% perfect, but it is moving us forward, Dr. Hamami. And I really appreciate that we have a plan to work on. And I think this is what the public wants to see. What's the plan, right? Not everybody's going to get the vaccine tomorrow, but we have a way forward, and I really like it. And I also recall from and somebody can comment on this later maybe, from that call, I believe it was Canton, that said they had kind of a call center and people had them on speed dial and automatic dial, like they were some sort of a robocall, people trying to get in. I think they said 1 million contacts, right, which just overwhelmed their call center. So I think that's a little bit of a cautionary tale for opening up a call center and how that works. So good luck in your deliberations there. I'll also ask Dr. Hamami, like I do on a regular basis, just like your presentation today in the updated info, or what we got from Mr. Turfy that explained how we're going to go to those communities. I would beg that commissioners receive this in JPEG format as well as PDF, because I can go right to social media and get it out to people. It takes me 3 or 4 days to get it into JPEG format, given some limitations. And by that time, data can be a little on the old side. So I would beg that when you send reports, updates, information to commissioners, that we get it in a JPEG format, that we can get it up for our constituents. Because I did put up the first 20, 25 minutes of your presentation of the full board last week, Dr. Hamami, and I got great response from that. But people said, yeah, it was too hard to follow all of the slides and everything. So I'm working right now on getting the slides turned into JPEG so we can share them. But I think this is what the public needs to see. And I think for the most part, even though, and we're all still getting calls, and I've had 2 of them today, how do I get to the front of the line? And I think any of the information sharing we can do, even if it says your turn's not coming up for 3 or 4 weeks, I think people want to see that. In a vacuum and not knowing that, people are like, I want to be in today. But most people are like, okay, we can see how many vaccines are coming in. We can see how many, and even if there's a number out there for how many 65 plus people we have in the county that we need to get to, so they can look at that, whatever that number is, 250,000, and look at actually how many vaccines we're getting and going, oh, okay, this is not going to all happen tomorrow. So I'm begging on the JPEG. And Dr. Hamami, I don't know if you want to comment on this right now, but just to add to some of the confusion that will be for the public out there, what the heck is going on with FEMA and Ford Field? Is that something you can comment on right now, Doctor, and how that would impact us as a county?
Unfortunately, Commissioner, no, because I don't have enough information. I know that some of our county leaders, and specifically from the county exec office, had a meeting with FEMA. It seems it's related to some mass vaccination that is going to happen. We certainly are at the table, and we will make sure that whatever is happening would include the county and the mostly our communities at need.
Yeah, because I actually got a media inquiry, a text last night at about 10 o'clock at night. A local TV reporter was like, hey, what about this FEMA meeting and what's going on? I'm like, I don't know what the heck you're talking about, you know? But I think that's another one where messaging is going to be important because right now we've got thousands of people that are calling and going online on dozens of different websites trying to get signed up. And every time somebody hears of a new location, of course, the mob moves that way then. So I think messaging is going to be real important there too, of like what is and what is not once that's set up. But I'm glad to see there's more of a plan from the feds too. But I'll tell you, calls and emails have slowed down in my office. It's not that they're at zero, but as we're making progress, and I would love to get your stuff today that you reported, you know, who we completed, who's still yet to go in a JPEG format. That will be really helpful to the public. This is where we are at today. And then if we can have weekly updates, that's a great presentation you gave us on Thursday. If that can be updated and once a week we can put that out, that'll be really helpful to the general public. So thanks for all you're doing, Doc, and thank you for the time, Madam Chair.
Thank you, Commissioner Colleen. Commissioner Anderson.
Thank you, Madam Chair. Dr. Amami, I've run through these as quick as I can here. When those that are vaccinated at the locations in the individual communities, will they go back to the same location for their second shot?
Yes.
And how logistically, how is that going to work?
The same way we set up the first dose, we're going to follow the same format for second dose. We try not to confuse people as in where did I get my first dose and where do I get to the second. That wherever you got your first dose, you will go back on that date that is on the card to where you got it.
Okay, and is that that means they'll pull nursing staff and those that are
Yes.
giving the injections
Yes.
away from any other. So
yeah, that's unfortunate. This is like this
Mhm.
week. I can tell you, we have several clinics, including the community clinics. We have almost every day a clinic either at Wayne County Community College or at Schoolcraft for the second doses. But it is what we are managing and how we're scheduling.
okay, and so we have the nursing power. I wasn't going to say manpower, but nursing power to cover those additional sites that come on board if we do a larger centralized location or more than one, or are we going to reach out to some of the fire departments, med schools, and others to get them on board to help with those larger vaccinations?
Yes, for both, Commissioner. We certainly would welcome every extra help we are getting. I think I shared that we're working with the National Guard that have been very essential in supporting us. All the extra man or women power that we're getting from the fire departments and the EMS services, our nurses, our volunteer nurses, all those we're putting them to great use whenever we feel stressed and we need to make sure that we have enough resources.
And are there concrete plans in place right now to handle the ramp up on vaccines as we begin to see more vaccines coming in?
Yes, we certainly are looking into other options. We're looking as well to see whether we can have community partners. This is happening. We're looking at maybe third-party contractors where they can help with establishing more vaccination sites and helping with vaccine administration. I think this would come in handy when we are more opening up with more vaccine and more of the public are going to be needing it.
So if we know of any companies that are third party, can we just pass those along to you or
Yes.
Carol or someone?
Absolutely.
Let's see, when will the county be ready to assign a single nurse to oversee the EMTs to get more shots in the arms for those departments that haven't been certified by the state to do it on their own? Are we working with some of those local police, fire departments in trying to get
in the communities?
Yes.
Well, we are doing some of that now. It all depends on when their turn is according to the list that we have. There are several options, as I mentioned. We can either have everybody come to a central location, or if we're doing that in the community, then what are the resources available, what are their capacities, and whether there should be a nurse that is there. We're doing that actually currently right now. And we have others like City of Livonia who are a COVID-19 provider. We don't have to assign them anything. They are doing this
Right.
on their own. So
Yeah.
it's a mixed model, Commissioner.
Good. And an issue that was brought up this morning on the conference call was that the county, if the county does as planned and stays in a community for a longer period of time, more than a couple of days, the communities that are coming along after them for the local vaccinations are going to start stacking up. And do we have any plan of how we will resolve that and not get months behind?
Right. So that is one of the reasons why we divided it to 4 regions. So we are not focusing on one community only. So although we have communities that might have bigger population or larger population of seniors, then at least when we do the 4 regions, then we are still doing 4 communities at once and moving along. We use this and we put this to the test, as Commissioner Colleen was saying. We had this plan for the educators and it worked perfectly. We had school districts that had 3,000 teachers, and we had smaller schools that had 20 teachers, and all that worked very nicely when we had divided them into regions. So those that have cities that have a smaller population, we can do 2 or 3 communities at one location versus a community that has 15,000 where we are focusing on that. So this is where the balance of the regions comes in handy.
Are we currently doing any vaccinations on Saturdays?
Oh, absolutely.
Okay.
Since the day we started, we always had at least 1 clinic. In fact, for the last 3 or 4 weeks, as I remember, we have 2 clinics on Saturday.
Okay, because I was thinking that might be one that would relieve the frustration of some of our local communities that can't go to a neighboring community that's having their vaccination because they don't live in that particular community, and have it just available to anyone, first come, first serve, by reservation, that is, and would let any resident of any community, as long as they have the reservation or appointment, come in on those Saturdays. If we could find rather than just maybe doing one location or doing one big location or something, if we could do something like that, that might relieve some of that frustration.
We can certainly look into it, sir.
Okay, that's all I have, Madam Chair. Thank you.
Thank you, Commissioner Anderson. Commissioner Marecki.
Thank you, Madam Chair. Thank you, Doctor, for giving us an update again. And I just want to say, I really appreciated that call this morning. 2 of my communities are on the bottom of the quadrant, the purple quadrant, and this gives them plenty of time to think through everything they want to do and to plan. So when it's their turn, they'll be able to hit the ground running, and it's good because they can learn from the other communities that have just started. And just an update, Livonia did start this morning. I've had 2 updates that it's running extremely well, exactly how they thought it would. I know Glenn asked this, I think he asked this, but I have a business that called today that has a huge facility, and they are not using it because of the shutdown. They're not able to use it right now, and they have offered it up if Wayne County needs anything. So should I just let you know that through an email, you and the whole group?
Sure. Yes.
Okay. Okay, it's right on the border of Livonia and Redford, so it might encompass several communities if you need it. I just want to put
Sure.
it out there. Okay, thank you again. I'm
Thank
all
you.
set. Thanks, Madam Chair.
Thank you, Commissioner Marecki. Commissioner Dodd.
Thank you, Madam Chair. I just wanted to comment on the idea of the hybrid approach. I really like that idea. I know that this is not a one-size-fits-all solution for every community, and I'm having a meeting with my Plymouth Canton team later today. We're definitely going to have some meetings after we have our clinic to see whether we liked having it in our community, or if we wanted have our seniors go to a central location like Schoolcraft or Wayne County Community College. So I'll definitely be getting back to you with that feedback, but like if we do like to have our own community clinic in our community, I would love to have that option. I know it's not going to work for every community, so I really want to encourage that hybrid approach so that we all have the option to do what's best for us.
Absolutely. Thank you, Commissioner.
Thank you, Commissioner Dodd. Are there any other questions? Any other questions from Commissioner Colleen? Did you have another question?
Well, actually, just a quick comment.
Oh, sure. Go right ahead.
MDHHS today, and I'm not going to do it as a quiz, is putting out a number for what % of the 65 plus have gotten their first vaccination in the state of Michigan. That number is 36%. So progress is being made. And it's the message that I kind of want to continue to send to people. And as the systems and our plan for the 65 plus, and as more of those roll out, we're not talking months and months and months on end until it's really a matter of the supply right now. And so a lot more people will get the shot when and if the supply improves. But Madam Chair, I was a little, quite frankly, a little shocked that 36% have gotten their first vaccination at 65 plus. And what that tells me is we're not doing too bad of a job out there in getting this done. So thank you, Madam Chair.
Thank you, Commissioner Colleen.
Madam Chair?
Well, yes.
So Andrew Kandrivas here. If I could just take a second.
Sure.
If it's okay. Yeah, I just wanted to comment. Thank you very much to all the commissioners for giving their input. It's I like to say, and we clearly state that science drives this, but the actual implementation is a lot more artistic than scientific, I think. And I think you are all seeing that with this diversity of opinions. Should we have micro centers so that it's easier for people? Because we've heard that from our local communities a lot. Should we have a central location, which, as Dr. H has said, we would love to be able to push everybody to a few community colleges. It makes it a lot easier. So there is an artistic quality to that. We are reaching out to all the communities, all the cities. So we appreciate you talking to your communities and talking to us as well. Hasn't all happened, from day one. We haven't had these, we don't have, this is a plan, as Mr. Colleen said, that we are rolling out with you. We're changing it, we're tweaking things. We need feedback from communities on what makes sense for them, both in terms of what resources they might have, as well as what, they would like to see and what they're getting from their seniors. So I feel really good about what Commissioner Marecki said, that, this gives her communities time to look at how they want to implement it. And I hope today was a good first day, if you will, with that countywide meeting on making cities think about this. It felt a little hard being attacked in a way for, you guys are giving us a bad product, when really we all want to create this product and come up with something. So, hopefully it'll smooth out a little bit. At least, feelings will smooth out today. Please reach out to me and let me know if there's any more communication that you would like to see to any individual communities. I'm very glad to talk to them one-on-one. So thank you.
Thank you, Mr. Kandrivas. One other question I just thought about from the call earlier this morning. There was a question as to whether the health care providers are still being given the vaccine, because we were directing seniors to contact their health care provider. Do we have any information on that at all?
Yes, we do. So I think there was a little bit of inaccuracy in what was reported this morning. The health systems were dealing with the exact situation that we had, is unpredictability in the volume of doses that they were getting, but they never stopped getting doses. It has decreased, and that has put some challenges, but they still are receiving their own doses. Part of why their allocation has decreased is because the state has contracted with Rite Aid and Myers specifically for that population. And again, I keep referring to the model of the pie. That meant their share of the pie was a little bit smaller. The state said that also they wanted to increase the health departments, and also now they are sending vaccines to the federally qualified health centers. These are the community health centers that had to come out of the share of the health systems. But all that redistribution was for the purpose of better serving the seniors. So I certainly, when it was mentioned this morning that we are still supplementing, we're not taking the full task, because there are actually more players that are vaccinating seniors than there was 4 weeks ago. So just because we announced that Wayne County is doing that, that doesn't mean we're the only one. And now, excuse me, everybody should drop every other channel and come to the county. This doesn't make any sense. We are still working all together. The hospitals are still able to do that. In fact, Henry Ford has expanded their reach, and they're doing a senior Saturday with the city of Detroit every week. So that means they are still getting doses. So the notion that they didn't get any and now everything is coming to the health department was not very accurate.
Okay, so we can still advise to contact
Absolutely.
your
Absolutely.
healthcare provider for
Healthcare
great.
providers, federally qualified health centers, Myers, Rite Aid, and us. These are the major players.
Great, great. I thank you again for all that you do, and thank you for giving us that thorough update that we need. And
Absolutely.
especially this morning, I think that was very, very helpful. Thank you. We look forward to seeing you next time.
Thank you. Good to be
All
here.
right.
Thank you.
Thank you. Madam Clerk, next item, please.
Item D2 under new business, communication from Health, Human and Veteran Services Department, Juvenile and Youth Services Division, forwarding the outcome date for juvenile and youth services programs for fiscal year 2018 through 2019.
All right, who do we have to give that report? It looks like Ms. Coleman.
Yes,
Dr.
ma'am.
Coleman. Director Coleman, welcome.
Thank you. I am having a little bit of a sorry about that. Shanetta Coleman, Division Director for Juvenile and Youth Services. This is our annual report for refile and receive and file. And it is a report of juvenile services that have occurred over the fiscal year 18-19. You should be having soon before you 19-20. We do submit these generally separately. After the first one's been approved, then you'll get the second one. It basically is all the services that have been delivered from care management organizations and some of our nonprofit partners who deliver prevention services. And it also provides you with a dashboard of trend data, as well as some of the key indicators that we use to measure service delivery and successes for those agencies who are supporting us, and the success and treatment goals of the youth who are participating in the program. I'm not sure if there are any questions. I do have the report if you'd like for me to put it up on the screen and draw your attention to a few things. I do want to say that fiscal year 20, of course, you're going to see something very different because of COVID, but also in 2019, what we are noticing is that there has been a decrease in services for adjudicated youth. Even if I take a 10-year look back in terms of how many kids we actually have participating in all the programs across the board, particularly for those who are some of our high-end users or those who have been officially adjudicated, we have about a 1,000 youth reduction in the number of youth who have been assigned to the care management organizations over the last 10 years. So I think that that is something that warrants bringing to your attention. And so, but the good thing is that the outcomes have steadily improved. Our recidivism rates are very low. And the care management organizations have done an outstanding job supporting these youth and getting them on the right care path. And the same would hold true for our service providers who do what we consider our front end services, prevention services, diversion services, and youth assistance program services, for which, by the way, we do give a lot of credit to the reduction in official adjudications, because we do have these prevention programs in place. And so you would see fewer kids adjudicated, which is really our goal. That's what we want to see. We want fewer kids in the system and to provide more front-end services to support them. That's
Thank
pretty
you.
much it. I could give more details if you want that, but that's what the report is about.
Okay, and did you want to highlight anything in the report? You said you wanted to show it, or no? You're what?
I could show it just for the, give context to the discussion. I don't have a problem doing that. I'll draw your attention to a couple of the dashboards, and maybe that'll help make sense.
Thank you.
So I want to really draw your attention. I don't know if can you see the report?
Not yet.
Great. So let me draw your attention here to the first dashboard. The first dashboard that you see here really is our trend data. And what this does is it gives us what I would call a look back in terms of where we started in 1999, some of the baselines that we were measuring for in
Director
1999.
Yeah.
So generally what you
Coleman,
see
can
on
you
this
hear me?
page,
She
the
can't.
comparison of where we were in 1999 and then the most recent 3 years of progress.
Dr. Coleman, we can't see the report.
Oh.
Yeah, I thought you couldn't hear me either.
Yeah.
For a minute.
She was in the groove. She didn't hear me or you, Madam Chair.
I'm so sorry. Let me see what's happening here. How about now?
That's it.
Thank you.
Thank you. Thank you for catching me. I'm just chatting along here. So again, this first dashboard is kind of a roll-up of what you're going to see year over year and what you would see in some of the narrative. So this is the comparison of where we were prior to reforming juvenile justice starting in 1999. On this report, generally you would have 3 of the most current years to compare against where we were in 1999. So if you look at the last year that's highlighted in the gray, our recidivism rates continue to be down. However, you will notice that there is a slight increase of about 1% from 2018. But 2017, we were down to 12.5. 2018, we were even lower of 11.6. And then 2019, we did creep back up a little bit. But those are still really good rates. They're under 13%. I think the general rule is about 20%. So I think we're doing an outstanding job here in Wayne County. Some of the other things in terms of successful outcomes for probation level 1, that probation level 1 is indicative of young people who are formally adjudicated, who are receiving in-home services in hopes that they do not matriculate further into the juvenile delinquency system. You will see year over year, before we start collecting that data in 1999, we have progressively increased in terms of our outcomes. So from 85.1%, 86.2% in 2018, 2019, it was up even more, 87.3%. That means that, you had less than 13% of the participants recidivizing or matriculating into the further into the system. So that's pretty much what this is. You could also look here, what I like to point out oftentimes is the number of days that we had youth confined to what we call state facilities or training schools. When this program first began in 1999, it was 731 kids in the system on an average daily count. 2017, 18, and years prior, that number was less than 5. Last year, we had a very difficult case that required a placement in Bay Pines, which is a mental health service provider, but it's a state agency. And so we did have one utilization for that, but we had not had any state placements for probably the last 5 years. So that would be something that is new that we've not dealt with over the last few years.
Okay, and this report doesn't really talk to 2020. I would be interested in knowing, because of COVID, Is there an uptick? And are you getting this data from the CMOs and compiling it together and coming up with the numbers?
Yes.
Okay.
So this report is only reflective of 19. You should be getting a report that will look and feel just like this for 20 data. We have already began to compile that data. You will see a little bit of a drop off in terms of the number of participants, and it's going to even show a decline even further, which is interesting because we also did some new programming efforts with Wayne County Third Circuit Court. So we were anticipating prior to the pandemic an increase in the number of kids who were able to participate in diversion programs or other front end programs. But because of the pandemic, where we could not do in-person services or supports, that number has decreased. But to answer your question, yes, the care management organizations use our what I'm going to refer to as kind of like an electronic record. So all of the engagement that they do with the young people participating in their programs, all that is contained in a database, and we have access to that database. And so we pull that data. We pull the data that's been reported in the database. We also look and do a cross-reference with their annual reports that they submit to us. And then we also do our own evaluations in terms of what we see in case files and what we see in the electronic files as well.
Does that also include the YAP programs in that database?
The JAS system does include data for YAPs. And we also have, as you know, the CMOs provide youth assistance program services. In addition, we have other providers that provide youth assistance program data as well.
Okay. And just so you know, I've invited the CMOs to give a presentation to our committee. So we understand them and what they do more of what they do.
Sure.
All right. Any questions from commissioners? Commissioner Killeen.
Thank you, Madam Chair. Make sure I'm off mute. Director Coleman, thank you very much for this report. And this is another, you were probably listening to the discussion about communicating with the public over the COVID. This has been such a tremendous success story for Wayne County in what we're doing with juvenile justice. When you look back at that 1999 data, which is when Governor Engler on his way out got the state out of the mental health business and handed it to the counties and said, good luck. Where recidivism was in the 50 to 60% rate when the state had it. We had all sorts of people at Boys Maxi training where they were learning to be real criminals when they got out to get people out of there. And I forget the name of the facility. I think it was in Adrian for young girls for juvenile justice, that we're not dealing with the state anymore on that. Mm-hmm. Are you putting this report on the website, Ms. Coleman?
I had not planned to put it on the website, but I guess we can. I'll work with our communications team on that.
Okay. Well, I think this is another one, like with a lot of things that we do. Wayne County government is kind of hidden away from most citizens for one reason or another. Either our fault, their fault, whatever. Wayne County government gets lost in the wash. And I think if this is, up on the website, I can share it with people. This is what we're doing. Get more of the story out. Hey, take a look at page 4 or whatever the summary data is. If you want to go into the rest of it, help yourself. But I think as a way of communicating with the public, if it could go up on a website and then we can just provide a link for people to go see the report, it's another way to spread the good news. And with that, Madam Chair, I'm not looking to stop conversation, but I'll move to receive and file this report.
Support, Marecki.
It's been moved and supported. Any discussion? Any other questions? All those in favor?
Aye.
Aye.
Any abstentions? Oh, excuse me, anyone that does not support it? And then any abstentions? Motion passed. Let's move to
Thank you.
the next. And thank you. Thank you so much for attending, and thank you for all of that great information. Great job that your department is doing. Thank you.
Thank you.
Mhm. Next item, Madam Chair. Madam Clerk.
Item 3, communication from Health, Human, and Veteran Services Department, Public Health Division, forwarding notification of a 1-year contract with 2 one-year options to renew with Memorial Healthcare.
Hi, this is, Hi, this is Carol Osterberry, Health Officer from Wayne County Health Department. Yes, and this is a contract, this was for testing for COVID-19, and as it says, the newly booked inmates. I don't know if it had my name on this, but I'm not sure if also Jennifer Caruso is on, if she has anything more to add to this. This is a continuation of the contract we had, the testing contract when we started with the COVID-19 pandemic and all of the newly booked inmates being tested upon, coming into the jail.
All right. Do they perform a blood test, or is it the nasal test?
Right. It is the nasal test, and I know when they started out with the program, they were performing the blood test, doing the antibodies also. I apologize. I don't know. Yeah. Oh, yes. Actually, here I'm reading this. Yes, it does include the serology, the antibody test also. Yes.
Okay.
Yeah.
So it's the nasal then. Okay.
The nasal and the blood, both samples are collected. Yep.
Okay. And with the individuals that test, are they the actual nurses, or are these trained individuals? That's what I'm asking.
Yes, yes, they are trained. They are not nurses from my public health department, but yes, they are the trained individuals to actually be able to collect the sample, the samples from the inmates. Yes.
Oh, great. Because that's important to know, because that nasal passage, is very sensitive. So
yeah,
you do it incorrectly, you can cause some serious damage. So,
yep.
Okay. Any questions from commissioners? No questions?
Colleen moves to approve.
Support Anderson.
It's been moved and supported. Those in
I think this is a
favor?
receive and file, right?
Was it?
It doesn't look like it. Does it say receive and file?
Well, wait a minute.
Forwarding. This is a contract, right?
Right.
It's
Yeah.
a renewal.
Yes.
Yeah.
Actually, this is, I'm sorry, this is Nellie Lee from HHVS. I understand Chris Albrecht is on the line too, and I think we're both maybe trying to speak up on the same issue. Chris, please go ahead.
Sure. Thanks, Nellie. Chris Albrecht, Commission Policy Staff, Policy Analyst. Sorry for the perhaps misleading information in the squib. We'll fix that, but this is indeed forwarding notification of an emergency procurement report for a 1-year contract with 2 one-year options to renew. So we'll make that correction on the squib. My apologies for that. This is, in fact, an emergency procurement report that is looking to be received and filed by the commission.
Okay.
Madam Chair,
right.
I will change my motion. If that's okay, I'll withdraw my other motion and move to receive and file this emergency procurement.
Support.
Then go right ahead.
I'm sorry. I'm very sorry to interrupt. This is Nellie Lee from HHVS again. I do see that on the agenda, I think there's a mix-up because there have been several Memorial Healthcare emergency contracts. This is indeed for the community. I'm sorry. This is for the I'm trying to look at the TCM number, and I wanted to make sure that we are correct and that this is for the laboratory capacity expansion for the testing. I just wanted to make that clarification. My apologies.
Okay, so this is not for to test inmates, or?
This is to expand the laboratory capacity to
Increase
process.
testing capacity for
Yes.
residents. Okay.
Yes, I just wanted to make that clarification. My apologies.
Okay. So this is still a emergency procurement.
Yes,
Okay.
and it is submit for receipt and file.
Receive and file. Okay. And so
Thank
it's
you.
been moved by Commissioner Colleen
Colleen.
and supported by Commissioner Anderson. All those in favor?
Aye.
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 Any opposed? Any abstentions? If none, motion has passed. Next item, please.
Item 4, requesting commission approval of a grant agreement with the Michigan Department of Environment, Great Lakes, and Energy.
Hi,
Right.
yep, Carol Osterberry again. This is our annual contract with, it used to be DEQ. And this is what supports the environmental public health programs for everything it says, like for private water, our public swimming pool inspections, sewage inspections. This is, every year we get this contract with the state for us to perform those services for those in those programs.
Great. And so when is this actually performed? Is it
Right.
like in March of each year or April or?
Yep, actually, public swimming pools, because, many public swimming pools are, at all the hotels, they're indoor pools. So they do all of those pools in the winter months. And then you're right, then for all those outdoor public swimming pools that open up seasonally during the, pretty much Memorial Day to Labor Day, time period, then we go out to those during the summer. Yep.
All right. Any questions from commissioners? Commissioner Colleen, go right ahead.
Thank you, Madam Chair. Ms. Osterberry, this 41,000, is this an increase from previous years? It seems to me we've been going along like on 23,000.
Right. Very good point. And they weren't able to reimburse us last year because of many of those pools being closed. So that's that. I know we looked at that when we were going through this with Mary Carr, and that's why that number is about double.
So it's a bookkeeping matter because of the strange year last year.
Yeah, exactly.
All right, thank you. I'll move approval, Madam Chair.
Do I have anyone to support?
Support Anderson.
All right, it's been moved and it's been supported. Any questions? No other questions. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? Motion passed. Next item, please.
E, such other matters as may be properly submitted before the committee.
There are no such other matters. I do want to just say how heartfelt and tragic it is that we have lost over 500,000 people to COVID. And it's just saddening, and I'll just be glad when we can move past this. And so I just want to tell everybody to be safe. Next item.
Public comments.
Are there any public comments? Any public comments in the as an email or anyone? If you can unmute everyone and see if there's anybody out there that has a comment, please. All right, it appears there are no questions and no public comments. Next item.
Adjournment.
All right. Well, thank you all for attending, and I guess we'll see each other
I closed my eyes and
and
put my
Motion?
hand
Who
on
motioned and supported?
has it, any,
Hey,
I'll
Anderson.
move it. Oh, or
okay,
support it,
Terry moved,
whatever.
Anderson support. All those in favor?
Hi.
Aye.
All right, good meeting. Thank you.
Thank you, Madam Chair.
All right, bye-bye.